A lot of people present with GI symptoms, as you know, it's the big,
Gut.
gut issues. Everybody's got gut issues. And so in the consensual reality, there's an expectation that a lot of their gut symptoms, apart from being leaky gut or SIBO, they have parasites. So this is a big hot topic. So when people present this, I think I have gut parasites. Very common presentation. So here's the interesting thing. The standard labs, you take stool sample and you send it to your standard labs under healthcare. The chances of them finding parasites is about 1 in 1,000.
Wow.
Because the people who do the parasite testing have about an hour's worth of training and they don't really know. Unless you have something obvious like blastocystis or giardia or something of that nature. But generally they don't pick up parasites. Then you go to the functional medicine stool tests. You go to Genova or you go to Doctor's Data, and then they run more advanced panels. And their pickup of worms and parasites is better than the standard labs, but also I can't tell you how many false negatives they get too. You get normal stool testing for parasites. So we've recently been running a lot of parasite testing through a lab out of Nigeria.
Wow.
And so that comes back usually with between 2 to 4 to 5 different worms or parasites.
In everyone?
In not everybody, anywhere, let me say from 1 to 5. I think 5 is the most I've seen. And so I previously, having got normal functional medicines parasite tests, would proclaim you don't have parasites. And then the person often would have a belief system that they did. And then I'd say, okay, in Mexico, they often run an anti-parasitic protocol as a preventative protocol. With your permission, if you have a firm belief that you have parasites and you agree to the risks, and here's the risks of the anti-parasitic medications, we can do a therapeutic trial of an this is the art of medicine.
Yeah.
Probably the gastroenterologist and the medical boards would completely have a fit with you. But this is how we practice medicine in the functional space. You look at the patient, you look at their symptoms, you look at their beliefs, you look at their labs. You don't deny them and say, I know best, everything I know is, you know nothing. You really enter into their field and okay, look, I haven't proved that you have parasites. But if you're convinced and your friend has parasite or your husband has parasite, I'm prepared to run an anti-parasitic protocol. Are you prepared to take the risk? Here's the risk of the medication.